Okay, so let's jump right in. Some really exciting clinical trial data has just dropped. And wow, it looks like we're seeing a huge leap forward in how we manage type 2 diabetes and obesity. We're talking about a new combination therapy that's putting up some truly remarkable numbers.
So here's how we're going to break it all down. First, we'll look at the big breakthrough findings. Then, we'll get into the science of how it actually works. After that, we'll explore the powerful data on both weight loss and blood sugar, check out the safety profile, and finally, talk about what this all means for the future.
So let's cut right to the chase. The main takeaway from these major trials is pretty clear. This combination therapy, called CagriSema, was significantly better at helping people lose weight and control their blood sugar compared to a placebo. And importantly, even compared to its own individual components.
Okay, so when you hear results like that, you have to ask, right? How in the world does this combo pack put such a powerful punch? Well, the secret is in its really clever dual-action mechanism.
See, CagriSema isn't just one drug, it's a team-up. First, you've got semaglutide, which you might have heard of. It's a GLP-1 agonist that helps reduce appetite and get blood sugar under control. But it's paired with cagrilintide, an amylin analog. This one's job is to make you feel full or satiated and help manage those glucose spikes you get after a meal. So they're targeting different but totally complementary pathways.
And this is where the real magic happens. It's a concept called synergism. Basically, it means that 1 plus 1 doesn't equal 2 here. It equals more like 3 or 4. By combining these two, you get this incredible 1-2 punch that has a much stronger effect on weight and metabolism than either drug could ever have on its own.
All right, that's the science, but let's see what that synergy looks like in the real world. We'll get into the numbers, starting with one of the biggest headlines, the impact on weight loss for people with type 2 diabetes.
The data here from the REDEFINE 2 trial is, well, it's pretty staggering. Over 68 weeks, patients on CagriSema lost an average of 13.7% of their body weight. Now, to put that in perspective, the placebo group, who also got lifestyle counseling, lost about 3.4%. That's a huge difference.
But you know, averages don't always tell the whole story. What's really impressive is this. Researchers looked at how many people lost 10% or more of their body weight, which is a really meaningful clinical milestone. And get this, nearly 2/3 of the people taking CagriSema hit that target.
And when you see it visually like this, the difference is just night and day. You've got over 65% of the CagriSema group hitting that 10% weight loss goal, compared to just about 10% in the placebo group. I mean, that is just a massive separation.
Now, weight loss is amazing, but for this group of patients, there's an even bigger battle, right? And that's managing blood sugar. So how did the therapy do there?
Well, the results were just as powerful. This chart shows us who hit the target blood sugar level, or an HbA1c of 6.5% or less. That number is basically your average blood sugar over a few months, so it's a huge deal for diabetes control. And look at this, an incredible 73.5% of patients on CagriSema got their blood sugar into that target zone. That's compared to less than 16% on placebo.
And remember that synergy we talked about? Here's the proof in the pudding. The REIMAGINE 2 trial put cagrilintide head-to-head with a high dose of semaglutide all by itself, and the combo won, hands down. It led to bigger drops in blood sugar and way more weight loss. This really confirms that adding cagrilintide makes a huge difference.
Okay, so the results are incredible. But with any powerful new treatment, the big question is always, is it safe? You know, can people actually tolerate it? So let's look at that with the same objective eye.
All right, let's be direct. The most common side effects were gastrointestinal things, nausea, constipation, and vomiting. And as you can see, they were reported way more often in the group getting the actual treatment than in the placebo group, which is pretty much what we expect with this class of medication. But, and this is a really important but, the investigators found that for most people, these side effects were mild to moderate. And, importantly, they were transient. That means they usually popped up when people were first starting the medication and ramping up the dose, and then they tended to fade away over time.
And, you know, the real proof of how manageable these side effects were is right here in the numbers of people who actually stopped the trial because of them. Only about 8.4% of participants on CagriSema dropped out due to side effects. That's a pretty low number, and it suggests that most people were able to tolerate the therapy really well.
So, when we zoom out and look at the big picture, what does all this data really mean? What's the bottom line here?
It really boils down to this. CagriSema has shown it's superior at tackling both weight and blood sugar at the same time. It does this with that powerful 1-2 punch from its synergistic mechanism, and it seems to have a very manageable safety profile, with side effects that are generally mild and temporary. All of this could potentially make treatment a whole lot simpler for patients dealing with both type 2 diabetes and obesity.
The results are just so compelling, and it leaves us with this final, massive question for the future of medicine. We're clearly seeing a shift away from single-target drugs toward these multi-action therapies. And with outcomes like these, it's not hard to imagine that approaches like CagriSema really could redefine the entire standard of care for metabolic disease.